Bismillahirrahmanirrahim. Dear students, in continuation of our previous lectures of surgical supplies, this is the fourth consecutive lectures on surgical supplies. As you are aware that surgical supplies are most important articles in a tertiary care hospital or secondary care, but wherever that surgical process are applied, they are essential part of a hospital. So in last time we have learned about the various type of sutures. They are synthetic, they are natural, they are absorbable, they are non-absorbable. Now in continuation of that, we learn about metallic sutures, surgical needles, and other suturing techniques applied during the surgical operations of different surgical procedures. So if you go through the metallic sutures, they are of two types, silver and another is made of stainless steel. You can see that how the silver are and how this picture in stainless steel metallic sutures are found. Further, silver sutures are then in the form of wire or foil. They are available and they are readily available. Silver sutures, they are all are antiseptic action, and they may produce irritation in some tissues over there. Furthermore, the stainless steel sutures are they are natural monofilament per unit effilament non-absorbables. So further they are alloy of iron, chromium and nickel also. Then they are also, you can see the picture of stainless steel wire over there. Then they are good TS even in infections, difficult to handle and tendency to cut through tissues. Further, they are very hard to tie and knot ends require special handling. Their potential to corrode or break at points of twisting, bending, or knotting. Further, not to be used with the prosthesis of another alloy, used in abdominal wall, sternum, closure, retention, tendon repair. Mostly in cardiac bypass surgery, they are used for the closing of sternum over there. There are eye needles. You can say there is an eye over in that needles. They are more traumatic, wide opening of tissues. They can be done. So they are eye needles. Then you go for surgical needles. Eyeless needles, much less traumatic. They produce less trauma. More expensive suture material are connected with the surgical needles, which are eyeless needles. Mostly in such needles, the sutures are already fixed with them, attached to these needles. So they produce, so they much less trauma they can produce. Then other suture techniques are surgical stapling devices. They are used for skin closure, made up of stainless steel, placed uniformly to span the incision line. Minimal tissue reactions, does not penetrate the skin. Excellent cosmetic result of this. Minimum the scars are produced after surgery. Second, speed and efficacy is more as compared to sutures. Advancement, introduction of absorbable staples, lactomer is there. Then surgical staples is there. And nowadays, mostly that to ease for a surgical closure, surgical staples are introduced. Now these you can say staple on this side, they are applied with the help of a staple gun. So they are also removed with the staple remover. Then other sutures techniques are also ligating clamps and clips. V-shaped steel, tantalum or titanium clips, strips of fabric or plastic material coated with suitable adhesives, essentially clips to replace sutures when when occluding, closing the lumen, central canal of a vessel or tubular organ, blood vessels, gynecologic and urological procedures are applied. New approaches in ligating clamps and clips, so they are absorbable material, polydiox- polydioxanone and lactomer, absorbs after their function is completed. No interference with X-ray or CT scan. Then staples and clips versus sutures. So their speeds, convenience, reduce infection rate, lower cost. If done properly, no cosmetic difference can be found. Introduction. The item related to surgical processes and other items which are medicines related items used for the patient's care through though not drug fall under the category of surgical and other items. Surgical instruments are specially designed, designed tools or devices for performing specific actions of carrying out desired effects during surgery or any operation. Now, surgical supplies are forceps, scissors, scalpel, needles or syringe, catheters, ETT, laryngoscope, endoscope, colonoscope, IV cannula, sutures and ligatures, IV sets, blood transfusion sets, gloves, tongue depressors, surgical dressings, cotton, gauze, bandage, adhesive tapes. Other health accessories, contact lenses, pulse oximeter, glucometer, ophthalmoscope, otoscope, blood pressure monitoring devices, thermometer, ECG machine, echocardiography machine, defibrillators, wrist brace, lumbosacral corset, cervical collar, headlights, nasogastric tube, hemodialysis machine, X-ray machines, CT scanning machines, MRI machines, TMT devices, nebulizers, oxygen cylinders, USG machines. Now, surgical forceps. Forceps are hinged instruments utilized for gripping of clasping objects. Those used to the medical field are manufactured from quality carbon steel in order to withstand the rigors of ongoing sterilization. There are many types of forceps, some are discussed below. You can know the hemostatic forceps. It's a fully serrated jaws, box lock, shanks, ratchet, finger rings you can find over there. Another one, instrument type name hemostatic forceps, also termed as artery forceps, clamps and snaps. Raw materials stainless steel. Main functions to clamp and restrict arteries tissue to control the flow of blood. Were used mostly general surgery. Important products features they have fine serrations of varying length in the jaws. Other comments, some patterns are available with sharp teeth in the jaws. Dressing thumb forceps. Serrated tips, good grip area, spring part over there. Instrument type name, dressing thumb forceps. Raw material stainless steel. Main function to grab and handle dressing and other materials. Were used mostly in general surgery. Important products, features, tweezer type are generally serrated without teeth. They come in many sizes and shapes. Califorceps, also termed as Rochester forceps. Raw materials stainless steel. Features either curved or straight. Used for gripping and holding tightly onto tissue, including rupture blood vessels. Alligator forceps. Raw materials manufacture of stainless steel. Used with their long shaft are utilized for retrieving objects from within and between cavities in the patient's body. Interesting feature, the serrated tips do not damage living tissues. Biopsy forceps. Raw material stainless steel features straight or angle shaft used grip and hold living tissues and are chosen when delicate and precision work is to be performed. Obstetric forceps. It is also known as brain forceps, used to help in fetal delivery for adjusting the position of the head of the unborn child during delivery. Chital forceps. It is used to remove the hot, sterile surgical instruments from the sterilizer and to place them to the sterile pouches. Surgical scissors. Razor sharp cutting edge, be beveled cutting blade with regular cutting edge, screw lock, shanks, finger rings, black coated for easy identification. They are used for cutting or dissecting the tissues, cutting the sutures, bandage, etc. Surgical scalpels. They are very sharp knives used in surgery where extremely fine cutting is needed. Tongue depressor. It is a device used to depress the tongue to allow examination of mouth and throat. You may have an experience when you go to a general practitioner and he examines your throat. Surgical needles. The needles are used for suturing the tissues. Two types, straight and curved. Straight used while working on the surface, curved used while working at the depth. They are round, triangular, flat. The curved may be half, 3 by 8 of 5 by 8 circle. Swab holder. It is used to hold a swab to cleanse the operational field in the depth. Urinary catheter. A urinary catheter is any tube system placed in the body to drain and collect urine from the bladder. There are three lengths: female 20 to 60 centimeters, male or standard 40 to 45 centimeters, and pediatric 30 to 32 centimeters. Their Foley's catheter. It is soft plastic or rubber tube that is inserted into the bladder to drain the urine. Complications of catheters use may include urinary tract or kidney infections, blood infections, urethral injury, breakdowns, bladder stones, and blood in the urine. You can see in the picture this is Foley's catheter. Suprapubic catheters. It is an indwelling catheter that is placed directly into the bladder through abdomen. The catheter is inserted above the pubic bone. You can see suprapubic catheter and how it is inserted inside the bladder over there. Long-term indwelling catheters. A, a catheter that is left in place for a period may be attached to a drainage bag to collect the urine. There are two types of drainage bags. One type is a leg bag, which is smaller drainage device that attaches by elastic bands to the leg used in daytime. The other type of drainage bag, a larger drainage device that may be used during the night. The drainage device must be emptied at least every 8 hours or when the device is full. Potential complications: urine with a strong smells or becomes thick or cloudy, fever, chills, urethral swelling around the catheters, bleeding into or around the catheters, catheters damage little or no urine despite adequate fluid intake, leakage of large amount of urine around the catheters. You can see indwelling catheter over there, picture of that. Endotracheal tube. It is a specific type of tracheal tube that is nearly always inserted through the mouth, orotracheal or nose nasotracheal. It is used to deliver oxygen in higher concentrations than found in air or to administer other gases such as helium, nitric oxide, xenon, or certain volatile anesthetic agents such as desflurane, isoflurane, or sevoflurane. You can see endotracheal tube with a picture of this endotracheal tube. IV set. Infuse set is used for the infusion of IV fluids and fluid derivatives. You can see various type of IV sets. Blood transfusion set. The set is for administering blood or blood products. Syringes. They are instruments meant for injections of parenteral preparations into the body cavity. Syringes are devices used to propel drugs into the body by various routes. Types: reusable, Lure, glass. This syringe can be used both for injection and aspiration. It is made up of borosilicate glass and available with glass or stainless steel nozzles and has to be sterilized before use. Available in 2, 3, 5, 10, and 20 ml and up to 50 ml or 60 ml capacity. Disposable lure. This syringe is made up of medical grade polypropylene. It consists of two parts and available in a sterile form. With the lure nozzle, they come in size 3, 5, 10, 20, and 50 ml capacity. Tuberculin disposable syringe. It is useful for the administration of small dosage of drugs and available in 0.5 and 1 ml capacity. You can see these three types of syringes. IV cannula. A cannula or IV cannula is a tube that is inserted into the body, often for the delivery or removal of fluids. IV cannula is inserted into a vein, administered of intravenous fluids, blood sample, drawn of blood sample, and for administration of drugs. The average cannula size is 14 is large and up to 26 is small. So this type of IV cannula over there. Otoscope. An otoscope or oriscope is a medical device which is used to look into the ears disease which may be diagnosed by diagnosed by an scope includes otitis media and otitis, the middle of and outer parts of the ear. You can see this is otoscope. Ophthalmoscope. Ophthalmoscope is a test that allows by the health professionals to see inside the fundus of the eye and other structures using ophthalmoscopes over the funduscope. It is used to detect and evaluate cysts for eye diseases. You can see ophthalmoscope. Colostomy kit. A colostomy kit is a surgical procedure which are used for the colon is bypassed and the intestine